Yes, please. Okay. Right. So if you have read and understood, considering the history taking station, kindly begin.
Hello, I'm Dr. Muhammad and as the exam surgical candidate. Today I have been asked to ask you some questions related to your condition. Are you okay with that?
Yes, I'm okay. Can you bring mic closer to you? We can hardly hear you. Thanks. Yes, continue, please.
May I confirm your name, please?
Well, my name is John and I'm 57 years old.
Nice to meet you, Mr. John. So what's brought you here today, please?
I've been experiencing abdominal pain and fever.
I'm really so sorry to hear that. When did you first notice that?
I had it for last 3 months. Now it becomes much more worse.
Okay, I'm sorry to hear that. Did it start suddenly or gradually?
It started gradually.
Okay. Is there anything which makes the pain increase or decrease in size?
Yes, whenever I exert like cough or had constipation or bowel movement, then I had severe pain.
Can you point to the site of the pain, please?
Below the navel.
Okay, how can you describe the pain for me? It is colicky or cramping?
It's more dull and continuous.
Okay, does it change throughout the day? Is there any specific time which may be increasing throughout the day?
It increases when I work.
Sorry?
It increases when I work.
Okay, I'm sorry to hear that. If you had to rate the pain from 1 to 10, with 10 is the worst imaginable, how would you rate it?
When I work, it comes to 8, 9.
Oh, I'm really so sorry to hear that. Do you want me to give you any kind of analgesic?
Right now, it's not that much severe.
Okay. How does it affect your day-to-day life?
I'm not able to work much with this pain.
I'm really so sorry to hear that. Is there any discharge or any fluid come from it?
No.
Okay. Have you been ever ill or have any fever?
Yes, I did had fever.
Okay, I'm sorry to hear that. Is there any redness or hotness or any sore overlying that area?
No.
Okay. Do you have any history of trauma at the site?
No.
Okay. Have you been injected anything at that site?
No.
Do you notice that you have change in color or numbness or swelling in your limb?
No.
Okay. Do you have any like straining when you pass water or stool?
Yes, I do feel strain.
Okay. Is there any bulging from any area when you have to pass water or stool?
Sorry.
Is there any bulge in any area in your abdomen which bulge during that
Any
strain?
bulging?
Yes, there is bulge.
Can you point to the side?
It's just on the left side.
Okay, I'm sorry to hear that. Does it decrease when you lie flat?
No.
Okay. Do you have any vomiting or any associated cough?
No.
Okay. Do you have any change in your appetite?
No.
Do you have any history of unintentional weight loss?
Sorry, history of?
Unintentional weight
Unintentional
loss?
weight loss?
No.
Okay. Do you have see your GP for any other reasons? Like, do you have any other medical condition?
No.
Have you underwent any surgery before?
Sorry, I couldn't understand.
Have you underwent any surgery before?
No.
Okay. Are you taking any long-term medication or allergic to any drugs?
No, I'm not taking any kind of drugs.
Okay. Is there any member in your family who has the same condition?
As you?
No.
Okay. Before I go, can I ask some personal question, please?
Yes.
What's your occupation?
I work at the store and I transport goods from here to there.
Okay, can you summarize your history now?
Before I present my case, if time would allow me, I would like to ask about systemic review and
Yes.
also idea, concern, and expectations.
Yes.
And okay,
All right. Yes. Now
57
can you?
years old male presented with abdominal pain 3 months ago, and
Yes.
also he has started gradually, and also he has left side bulging, which is increased with this training.
Yes.
Also, with increase with cough, it is done in nature, and also there is history of fever, no history of the family history,
Yes.
and
So what are your differential diagnoses for this patient?
it can be due to pseudoaneurysm, or it
Yes.
can be due to hernia, and also can due to infected lymph node.
Okay. How would you confirm your diagnosis? What investigations would you ask for?
After taking history, I will examine the patient firstly, then I will ask for investigation, routine investigation, CBC, urea electrolyte, and also LFT. And
Okay.
also I will ask for CT angiography and double scan.
Duplex. Okay. Can you tell me what are the treatment alternatives that you can offer to the patient?
Okay, it can be surgical or non-surgical, non-operable.
Good. Yes.
First, non-surgical can be due to percutaneous duplex guided compression,
Okay.
and also can be due to injection of thrombin. Percutaneous injection of thrombin can be surgical ligation of the involved artery with delay revascularization.
All right. How do you know when an aneurysm is true aneurysm?
If it's true aneurysm, then it affects all the layer of the blood vessel, tunica media and vestigia and the inner
Yes.
layer.
As compared to pseudoaneurysm presents as?
It only affects the two outer layer. It's due to blood accumulation between the outer and the media, tunica adventitia and media.
Good. Right. One little advice or suggestion. When I asked you for differential diagnosis, you said pseudoaneurysm. Pseudoaneurysm in itself would not cause any symptoms since the patient was also having fever. So aneurysm, pseudoaneurysm, even pseudoaneurysm was infected. That's why there was a fever.
Okay.
So infected pseudoaneurysm, you have to say. Good. I think your history, as always, is systematic. It's like flows good. It's easy to understand and follow, and the things that you couldn't answer, like you couldn't ask, you did summarize at the end. So it was as good as being done. So anyone else want to add anything?
Yes, ma'am, there is one question.
Yes, please.
Since one of the differential is inguinal lymphadenopathy, shouldn't we
Yes.
ask about sexual history?
Yes.
Hello.
That should be that. Yes, that should be ruled out as well.
Yes, and because
Yes,
there
it's a
was
good
a
question,
differential
yes.
of inguinal lymphadenopathy, so wouldn't we
Yeah.
actively ask about any infection or in any discoloration about in the
Yes,
toes or nail beds?
discoloration he asked, but then not in particularly of toes, limbs discoloration he asked. So yes, that could be ruled out. Yes. Good.
Thank you, ma'am.
Anything else anyone want to add? Good. Thank you. And here is